everybody, it's me, Claire, and welcome back to my Red Chair as we continue to celebrate the good news in our community every Friday. I'm so happy you're here. Synergy Services is dedicated to providing our clients with the highest quality medical, dental, and vision healthcare available in Kansas City. The Teens and Tots Clinic is consciously designed and operated to overcome barriers that prevent homeless and other uninsured individuals from accessing regular healthcare. The environment, hours of operation, forms, exams, and follow-up services all cater to a client's unique needs and circumstances, and no one is turned away due to an inability to pay. This week, I'm very excited to introduce to you Stephani and Deb of the Teens and Tots Clinic right here on Synergy Services Youth Campus in partnership with Children's Mercy and Level Up Kids. Everyone, let's give them a warm welcome to the Red Chair. Deb, Stephani, thank you so much for joining us here today on the Red Chair. How are both of you?
Doing really great. Thank you for having us here today.
Yes, and Claire, it's very nice to have you, and we've seen some videos on the Red Chair, and we're really excited to be a part of this. So
well, we celebrate
for having
all
us.
the good news here, so it's great to have you. And here at Synergy Services, we are so thankful to be partnering up with Children's Mercy, as well as several other community partners to provide the Teens and Tots Clinic here on our youth campus. Now, Stephani and Deb, could you both share a little bit about what exactly that program is here at Synergy?
Sure. So this program started as a clinic for the youth on Synergy's campus over a decade ago. We just celebrated our 10th anniversary in May, and we have been lucky enough to be here, Deb and I, the entire time that clinic has been in existence. And through kind of the needs of Synergy evolving, the needs of our clinic and the scope of what we do and who we serve has evolved as well. Deb can talk a little bit more about that evolution.
Right. So we started with Stephani here initially, serving youth from the Synergy House, so the adolescents at that age. And over a few years then from the Women's Center, it was determined that those children also needed a place to be seeing the younger kids, which we weren't in the process of seeing at that time. So some years back, we started seeing the kids age 5 and up for any one of the women who are at the women's shelter. We're happy to see those kids and provide primary care service for them as needed. From then came, with the maternal group home, it was decided that those young children may also need to be seen occasionally. So about a year ago, in May of 2019, we included the kids at the maternal group home, so the younger children. So that brought about a new set of circumstances that we needed to deal with. The younger kids, things like blood pressure cuffs and scales and things like that for very young kids.
A little smaller than the teenager equipment.
We were used to, right. Yeah. We were able to secure a grant from Harvest, and with that we were able to buy a HPV freezer vaccine, which allowed us to stock vaccines that needed to be frozen as well as refrigerated. So we have been able to vaccinate kids in the maternal group home, those youngsters, and get them back to daycare sooner when they were being held out because of lack of vaccines. So that was a real positive that we saw from that. And then of course we also want them to continue to see their primary care providers, because we're not that, we're that piece of extra that we can help them with things that they need. So we're seeing youth from there as well.
I know we get a lot of referrals from school social workers who have youth who are either unaccompanied or kind of disadvantaged and don't have insurance or don't have readily available guardians to support those needs. And so they're able to come to this clinic, get primary care services, make sure that they're staying well, that they're not delayed or retained from school because of some medical need that they have. And so we're really proud to be able to offer those services.
That's incredible. Well, for both of you, could you speak a little bit more about what your role is within the clinic? I have heard you do so much, so I'm very excited to hear this as well.
Sure. So we both function as the providers, the nurse practitioners within the clinic. And the day that we are here seeing patients, we have a nurse that partners with us to be able to provide kind of the full scope of care that you would expect to kind of get in a kind of pediatrician's office. But our focus is really to be a medical home for disadvantaged youth who otherwise wouldn't be able to seek that care. And some folks just like to come back to us, which I think is pretty cool. So they might leave Synergy and go on to their next phase of their life, and they can always come back and kind of continue care with us should they desire to, which I really love.
I agree with that, and I think it's really a fun thing and exciting when we see a youth and they realize they can come here even after they leave Synergy. And they're always like, you mean you can be my doctor? I can come back here? And so having them have a face to someone that they can see and trust for their medical care is really an exciting thing for me. That's one of my favorites, I guess.
Well, we are so thankful again to have you here on our campus. And with the importance of this clinic here within our community and for the youth, children that we do serve, what were some of the steps that you did take to adapt amid the global pandemic?
Yeah, so the steps have been many and involving, as with everything else coronavirus specific. But because we are a part of Children's Mercy, we have the great amount of resources that Children's Mercy has, including our infectious disease specialists and communication with health officials. And so we have utilized the protocol changes at Children's Mercy and brought those here to the clinic. So that includes things like universal masking. Everyone in the clinic wears a mask to prevent kind of a sharing of droplets, if you will. We, of course, do kind of appropriate protective equipment, so we're wearing gloves when we need to, and trying to see the youth who need to be seen. And we've made some other changes as well about how we see patients.
We've integrated and been able to continue to see some of the community youth by using telehealth. So that's been another plus that we've incorporated into our care. At this time, we're slowly integrating community youth back into our clinic to see them person to person, and those youth who have been affiliated with Synergy in some way in the past. So unfortunately, right now we're not taking new community youth, but we look forward to that in the hopeful near future, being able to see them again as well. But we're always available via telehealth, and I believe the SOS workers have reached out to some of the community youth, and we've been able to touch base with them through the SOS helpers. So that's been great as well.
So for our Synergy House youth right now, which is that 12 to 18 age group, what is currently accessible in the clinic?
So it's essentially business as usual for those teens at the house. Anyone on campus, including TLP, youth and young adults, can come to clinic for in-person appointments. Again, we've got that universal masking rule to keep everybody safe, and so youth coming to clinic and the staff in clinic, we're wearing masks, of course cleaning everything as we always do to keep everybody safe. And so those visits and the types of visits are unchanged. We've been able to kind of keep that going.
Well, thank you so much for, once again, the work that you're doing, and I'm sure that you have faced ups and downs as we learn more about this every single day. So what would you say is your biggest challenge thus far?
I'd say one big challenge is just keeping the anxiety level at bay. We know globally the pandemic has caused increased anxiety and across the board, and certainly the youth at the house are already experiencing crisis, and then you have the pandemic, it just is increasing their anxiety level. So I think working with them and the staff to incorporate the appropriate PPE and just how important good hand washing is, wearing masks and social distancing as best they can in the house has helped to alleviate some of that anxiety, we hope.
There's so much information about COVID. We can all stay up 24 hours a day consuming the information online. And youth, of course, have access to that as well. And so when they come to clinic and they might have heard something or believe something about COVID that we don't have evidence to support, it's been a really great opportunity to help youth learn how to digest that information in a healthy way.
Great. Well, for both of you joining us on the Red Chair today, here at the Red Chair Chat, we celebrate all things good news. And I heard that you both have some very exciting good news to share with our viewers today. I'm excited to hear this.
Stephanie?
This has been an incredible team effort, starting with the executive leadership here at Synergy, recognizing a need to care for youth in a better way as we go into COVID. Kind of what happened with COVID is we all need to socially isolate or socially distance, and in a youth shelter, that can be really, really challenging. And so Synergy and other organizations in the community and nationwide have really reduced the number of youth they've been able to serve, to try to accommodate kind of quasi-isolation of everybody. And so the executive leadership kind of recognized that as kind of, what can we do about this? And they reached out to us. Because of our existing partnership, we've together developed this program where we're able to offer COVID testing to all new youth coming into shelter. That allows Synergy to have that information to take on more youth as they learn who is negative, who can double room as usual, and who truly needs to be isolated, and kind of divert the appropriate resources there. So our goal with this kind of testing project is to allow Synergy to care for more youth as they did pre-COVID, to the best of our ability.
And we had our first
Yes.
group testing yesterday. So we were able to test 9 youth. It was great as well.
Great. Well, I would have to say that I think that is some good news right there.
Yes.
I am so pleased to hear that. And thank you so much to you, as well as your entire team at Children's Mercy, for everything that you do here at Synergy, the impact you're making on our community. And Deb, Stephanie, thank you for joining me here today on the Red Chair.
Our pleasure. Thanks for
Yes.
having us.
So thankful to be here and be able to take care of the youth with you all. Thank you.
Wow. We are so lucky to work with Stephanie and Deb to provide such an incredible service to our community. That is certainly some good news. Our next special guest is here to share his good news on everything from the coronavirus global pandemic to his career aspirations, clever jokes, and the 5 reasons why floods happen. Without further ado, I'm so happy to share the Red Chair with my friend, Jack. So, Jack, it's very exciting to see you here. Welcome to my Red Chair. I'm very happy to have you here with me. I heard that you just had a birthday, and you had a birthday party. What'd you do at your birthday party?
Me and my mom got some stuff that we like. It's confetti blowers.
Confetti. That sounds like quite the party. That's some pretty good news, I'd have to say. Little did I know today, I have a celebrity in my chair with me, Jack Spectacular. How very exciting that is. Okay, so tell me a little bit about this. So you've been very busy making dinner for someone?
Sharon, there's been a lot of bad people in town, like bullies.
There's been bullies in town, and so you've been making her dinner to make her feel better? Busy.
Yeah, we cooked her lasagna.
So now you're 6, Jack Spectacular, and you get to go to kindergarten this year?
Well, I plan not to going, because I do not want to forget my locker number and other reasons. Bullies. I've got a joke.
Oh, here we go. I'm excited. Let me hear it.
I traded a Smartie for nerds. I think you look like a nerd. That's a joke. I blew your mind.
I think you did.
It's a germ.
A germ.
That.
Jack, do you know how to keep yourself safe from coronavirus? What have you been doing? What did you wear today to come see me?
These clothes. This is basically old and wrinkly. It's not. What's a nacho that's not yours? Nacho cheese.
That was a good one.
Basically, by just wearing a mask or probably staying in your bed till it's over.
Will you show our viewers how to put the mask on?
Just put it over here like this. Basically, kids can't see.
Can't see? How do you walk? What?
Get out the water slide 10 times on different days and have water balloons 72 days. 72.
So I want to know what's some more exciting things you've been up to.
Basically just walking around, snooping in the nighttime. I'm like, probably when I'm like a grown up, I'm gonna be on the news.
So tell me more, Jack Spectacular. You want to be on the news? What do you want to do on the news?
Just gonna talk about floods and hurricanes. There's 5 ways a flood can happen. One way is a hurricane. It picks up giant water and it rains it all down on land. And then it floods. If there's too much carbon dioxide in the air, the ice caps and the temperature of the earth will rise and it will stream all the way to the ocean and cause land at sea level and land at coast will be covered. The whole land will just be called the land ocean.
The land ocean. Wow, it seems like you're almost ready to be on the news already.
And the third way a flood can happen is by an ice jam. It's when giant ice floes block the flow of water, and then it causes it to. And there's a bridge above, and then you're on it, and it's a little higher, so it couldn't get up there, but you would have to run. 6 inches water could knock a person off its feet and take it all back to some other place.
Wow.
Unless you have a secret laboratory or something up high on a skyscraper. Increasing water that has no place to go.
What's the fifth way that a flood can happen?
I think it's I don't remember. I think it's by a flood that happened suddenly.
Uh-huh.
Why the chicken go the road to get to the other side? Yeah, I can't wait to be a wrestler.
So you're going to be a newscaster and a wrestler? Can I see your muscles? Put them in the air. Oh, look at that.
I can be an astronaut and climb up a ladder to the moon and kiss the stars. Ooh, my tummy's growling.
Oh, because it is almost lunchtime.
Let the chicken cross the playground because it wanted to see the Nacho Fest.
No! To get to the other slide?
No, the Nacho Fest, like with food trucks. It's all about nachos, you silly goose.
It's all about the nachos, I think. There
You don't
we
even
have
eat
it.
nachos.
Thanks for joining us on the Red Shirt Chat.
Woo! Well, my friends, that was all sorts of good news and some great jokes from our friend Jack. Here at Synergy, you saw firsthand good news happening in all of our programs, just like our teens and Tots Clinic. All in all, we couldn't do it without our entire community rallying behind one another and truly becoming the heroes, the helpers, the supporters. So thank you all for being the helpers right here in our community. On behalf of Stephanie, Deb, Jack, and myself, Claire, thanks for joining us on the Red Chair. Stay safe and healthy. We'll be back next Friday for our Red Chair Chat with more special guests and even more good news. Have a great weekend, and don't forget, be kind.